Thank you very much for taking the time to join us today. From the Legislative Building in Regina, we'll have Premier Scott Moe, as well as Saskatchewan's Chief Medical Health Officer, Dr. Shahab, and then we will take some time for questions. Premier?
Thank you. Well, good morning, everyone, and thank you for joining us here this morning. Last September, during what was a very serious Delta wave in Saskatchewan, our government introduced a proof of vaccination requirement in a number of workplaces and public venues across the province. When we first introduced this policy, I would be the first to admit that I was reluctant to do so. I knew there would be much benefit from a policy such as this in the fight against COVID and at that time the Delta wave, but I also knew that that benefit would come with significant cost. I knew that this policy would create deep divisions in our families, in our friendship groups, in our province, and in communities across Saskatchewan. But people would potentially have different access or rights based on what their relative vaccination status would be. That is the result of that policy. So what was actually a pretty extraordinary step to take in this province effectively created two classes of citizens. To my knowledge, this province has never done anything like that before in our history for any vaccine or for any other reason for that matter. For a time, during that Delta wave, I do believe that the benefits of this policy most certainly did outweigh the costs. There were many more people that went out and got vaccinated, their first dose, their second dose, and ultimately, more recently, their third or booster dose. And COVID transmission was significantly reduced as we found our way through the Delta wave last fall. But today, as we deal with a very different strain, the Omicron variant, the benefits of this policy no longer outweigh the costs. Many more people today are vaccinated than they were prior to us putting that policy in September the 16th. 85% of those that are eligible in this province have received their first dose. 80% of those that are eligible have received their second shot and are now fully vaccinated, and nearly 50% of those eligible have also went out and received their booster dose. While vaccines are still widely available in Saskatchewan, and they will remain widely available across this province, lately vaccine uptake has slowed to some degree. And vaccination, as we know, is not preventing transmission of Omicron like it did with previous variants. And I will continue to encourage everyone and anyone that is eligible to go out and get vaccinated, your first, your second, and ultimately your booster dose, as vaccines most certainly do provide significant protection against serious illness from Omicron or any other variant. However, if someone makes a different choice about whether or not they are vaccinated, that's their right, and this government is going to respect that right. Today, with Omicron, the benefits of the proof of vaccination policy no longer outweigh the costs. This policy most certainly has run its course. So it's time for us to take a step back in living with COVID and to make every effort to get our lives back to normal. It's time for us also to heal the divisions in our communities over vaccination. Those divisions are in our families, they're in our communities, but they are across our province and they're across this nation. It's time for us to come together as families, as friends, as communities, and as a province and as a nation, and it's time for us to reach out and support one another. Let's not judge our neighbor because they may be vaccinated or because they may not be vaccinated. Let's not judge our neighbor if they should choose to wear a mask or not to choose to wear a mask in the weeks ahead. Whenever someone is doing their own personal risk assessment, which we have asked them to do in this province for a period of time now, they're doing that assessment for themselves, possibly for their family, and they may come back with a different decision than what you might arrive at. And that different conclusion, albeit maybe different from where you have landed, should not be judged. It should be respected, and it should be accepted. It's time for each of us as individuals now to make a conscious effort to treat everyone in our daily lives that we encounter equally. It's also time for the proof of vaccination mandate to end. So effective at midnight this Sunday, February the 13th, all provincial proof of vaccination requirements will end. In Saskatchewan businesses, in venues, and provincially regulated workplaces, this means that the proof of vaccination or the negative test option that we had provided will no longer be a provincial requirement. Starting on Valentine's Day, February the 14th, this will be the case. This will leave one remaining COVID measure in place, and that is indoor masking. That measure remains in effect until the end of February. I want to thank all of the businesses and the venues and the workplaces who have shifted course throughout this pandemic to keep their employees and to keep their customers safe, and all of those who implemented and administered the proof of vaccination or proof of negative test policy over the course of the past few months. Thank you for doing your part in our fight against COVID. And again, I want to thank everyone who made this choice. It is a wise choice to ultimately go out and get vaccinated. You are keeping yourself safe. As we move into this next phase, the phase of now living with COVID, I would ask you to continue to make wise choices. This is paramount to our success. Go get your booster dose if you haven't already. Stay home if you're not feeling well. Do a rapid test from time to time. If you do test positive, we want you to stay at home for 5 days. But let's all, in the meantime, also get back to living our lives normally and doing the things that we all love to do. And let's all make that extra effort to be just a little more understanding of others when we may disagree. In fact, this may well be our largest challenge in getting our lives back to normal in our families, in our communities, in our friendship groups, and in our province. We must realize that it's okay for us to disagree. We do hold strong opinions in this province, and those are on full display often. But we can disagree without being disagreeable. Don't lose a friend to COVID. You might have to take some time apart, but keep that door open. Time and time again, Saskatchewan people have proven that we achieve great things when we come together and when we work together, and when we accept those who may have a different opinion than we do, and when we respect others' individual decisions. We are poised to lead this nation through COVID, and we are poised to lead the world in an economic recovery in this province. So let's work together. Let's work together to heal some of the divisions. Let's understand that we can forgive our friends, our family members, maybe even ourselves, if that is necessary. Let's work to heal those divisions. Let's come together, and let's once again be ourselves in our communities. This is a great province. This is a united province. But most importantly, this is a tolerant province, and we are going to need all of that tolerance in the days ahead. It's time for us to move. Thank you. Dr. Shahab, do you have some comments?
Thank you, Premier. I'll just clarify a few things. Obviously vaccines remain available, 5 to 11 first, second doses, additional doses as required for severely immune compromised. 12 and older, as announced today, booster doses are available. For 12 to 17, they are available 5 months after the second dose. So most 12 to 17-year-olds got this second dose July, August, so there shouldn't be any problem accessing that. It's just a reminder here that the online booking now is defaulting to 5 months. So if anyone 18 and older wants a booster before 5 months, they can call SaskVax 1-833-727-5829 to get a booster. If you're 18 and older after 3 months, but 12 to 17, they can get a booster after 5 months. However, 12 to 17-year-olds who are severely immunocompromised have been eligible earlier for a booster at 3 months, and they will continue to be so. I think that is all just a reminder that outbreaks will publicly be reported only in long-term care homes and personal care homes, similar to other respiratory outbreaks. And public health will continue to investigate in those high-risk settings, including personal care homes, shelters, and group homes. And just a reminder that Thursdays is when the weekly dashboard, as we discussed last Thursday, will be posted for a summary of case numbers and trends over the last 7 days. But that will be up till Sunday of the previous week. So it'll be a weekly epidemiological survey summary posted every Thursday. Thank you.
Thank you, Premier. Thank you, Dr. Shahab. We'll now move to questions, starting in the room. We'll start with Larissa. Do you have a question?
Sure. So as far as I'm aware this morning, Saskatchewan is the first province to remove this proof of vax policy here. Why is it that you think that the province is ready for that, and why should we be the first province to do that?
Well, we're not removing it today. It'll be removed at midnight this Sunday. We're the first province, yes, to announce that we'll be moving in this direction. I think you will see other provinces providing their citizens with what their plan is on how, as we see cases decline in Saskatchewan and across Canada, as we see hospitalizations decline in Saskatchewan and across Canada. I have no doubt that you will see other provinces putting forward what their plan is on living with COVID and taking steps towards getting life back to normal. That will vary given the individual cases, that individual situations that we see in various regions of Canada. I would put forward that the federal government also should at some point in time be putting forward what their plan is for the federally regulated industries as well on behalf of Canadians. Not because we should as Canadians know where we are going over the course of the next number of weeks, whether you work in a provincially mandated sectors, which is what we control here today, but also in the federally mandated sectors such as transportation, for example, air travel, things of that nature. And so I think you're going to see other provinces quite likely come forward with what the next number of weeks look like in their respective jurisdictions. And I think in fairness, you'll probably see the federal government as well in the next while come forward with what it looks like for those areas of our communities that are regulated under the federal government. As we know with Omicron, we've been over 20 months, with COVID, not Omicron, but with COVID proper, we've been dealing with this for close to 2 years now. Should things change in 2, 3, 4 months, then ultimately we would have to continue to make the best decisions in light of protecting our healthcare capacity. But for today, where we are with reducing hospitalizations, reducing numbers, we're confident as we move ahead with this phased approach that we are going to take these steps back to normal by reducing and eliminating the public health orders that are in place. But we'd also ask Saskatchewan residents to be gracious and to understand that everyone is doing their own personal risk assessment and they might arrive at a different conclusion than you, and we should accept that and we should respect each and every one for the decisions that they are making in their environment.
You have a follow-up question, Larissa?
Yes, thank you, President. So you had said in your earlier remarks that part of the reason you were wanting to get rid of this proof of vax policy was that division between having vaxxed and unvaxxed residents and the access that causes. But it is a divisive topic. There are people who have very strong feelings either way about having that policy or not having it. How do you see that the decision being made today to remove that policy at the end of the week to bring people together? It's obviously something that's kind of dividing citizens.
Yeah. So the reason we're able to remove this policy is it's run its course. It has increased our vaccination rates in the province substantially since it was introduced, as we found ourselves in the Delta wave, as we find ourselves in the Omicron wave, which is much more transmissible. The two vaccines do not prevent in any large way the transmissibility of COVID, but it most certainly does help when it comes to the severe outcomes of COVID. So this policy has run its course, and it has enhanced the divisions on whether you are or not vaccinated by saying if you want to go into, let's say, a restaurant, you're going to need a negative test if you're not vaccinated. As we move forward, I would view whether or not you're vaccinated against COVID in very much the same scope as to whether or not you get a flu vaccine each and every year. I don't think getting a flu vaccine is in any way a divisive conversation in the province. I often do, virtually all the time. I do get a flu vaccine simply because I see a lot of people. But I don't talk about that like we have with whether or not we have a COVID vaccine. And so I don't view it as a divisive conversation as we move forward. I view it very much in a similar vein as to whether or not you got a flu vaccine, which seldom, if ever, comes up in anyone's conversation. But that's going to take some effort. That's going to take some individual effort, and I would ask everyone in this province to make that effort. Not focus in, judge, or in any way concern yourself with, who is vaccinated and ultimately who is not vaccinated. Make your own personal risk assessment for you and ultimately your family, and that will be different for different individuals depending on their age, whatever goes into that decision. And I would ask people to do that, and I would also ask them not to in any way judge anyone else for the fact that post-February 28th they may be wearing a mask. That's normalized in our society. It should be accepted. And if someone is making that decision, you may not know the reasons as to why they are making that decision, and I would say that we should respect it.
Next we'll go to Lynn.
Both you and Dr. Shahab and Vass have talked about this, making your personal risk assessment, and but you basically just said that people shouldn't ask other people if they're vaccinated or not anymore after this is gone. And we're getting progressively less and less data on COVID-19. How are people supposed to make accurate risk assessments for themselves if they have so little data to go off of?
Do you want to speak to the data first, Dr. Shahab, and then I'll maybe speak to the personal risk assessments and such?
Yeah, so in terms of data, I always used to look at 7-day averages, and we used to get 7-day average data every day, but now I'll only get it on Thursday. So I will only be looking at data for the most part once a week. And I think it is a bit of a different, we need to all get used to it. I think ever since late February, March, we've been looking at data every day, and people who are assembling that data were getting up every day at 3 a.m., starting to assemble that data at 4 a.m. But, it was less and less useful on a daily basis. So certainly I think this Thursday we'll see our first data cut, and it may not be the final format. There will always obviously be some feedback. But I think that will tell us in general terms, what is the state of Omicron activity in the province. And that will guide us. That'll be one data set that will guide us. But then, many people already have seen in the workplaces, schools, that the Omicron wave came, and in most jurisdictions, most schools, it has visibly passed. As we discussed last week, it has peaked over the last week or two. Hospitalizations are peaking as we speak, or a week or two, and may go up a bit for a week before they start descending. But all of that information will be in that weekly summary that I think will give us better information, which is adjusted to the way Omicron has been behaving. But having said that, I think we need to start visualizing how we will manage ourselves. Obviously starting February 14th. With the proof of vaccination no longer required, but that'll still be available through QR code for travel, and if you're in another country or jurisdiction where it may still be required. And certainly I think we need to start visualizing that the current orders for mask use are in place till February. If our trends continue, there will be a time where mask use will not be a mandatory order, and we should start thinking about at work, at school, how, what our decisions would be for ourselves, our children. And again, we have been in that place before several times during the last 25 months now, 26 months, and we will be again. And it's just a matter of, becoming comfortable where we see ourselves in March. But obviously that information will be available on a weekly basis. I think it will be a richer data set given how the reporting had to change with Omicron. But again, let's see on Thursday how it is, and obviously it will continue to get adapted according to what data is more useful.
Which is in many ways how public health manages many other communicable or transmissible diseases that we have in this province each and every year, and they will use the same alerting mechanisms that they have should a community or for instance, a center or someone have to be alerted in some way, shape, or form. We do this with many other communicable diseases today. Just in your question, Lynn, you had said, should we or should we not be asking people whether or not they're vaccinated? And I have no opinion on that. What I am saying is we shouldn't be, as we move forward and we truly want to get back to normal, We shouldn't be dwelling or focusing in on, what other people's decisions are. We each should do our own personal risk assessment as we find our way through the next number of weeks. I would put forward that Saskatchewan people are, in many cases, and families are doing that already. And wherever anyone lands on that, the decisions that they make coming out of that personal risk assessment, it may be wearing a mask to an event, it may be not attending the event, it may be, attending the event under certain circumstances that their family is comfortable with. What I am saying is, we should get back to a time where we were pre-COVID, where we accept the fact that other people are making the decisions they are for themselves and possibly for their family, and we should respect that. When we see people with a mask, it's normalized. We should by no means, whether or not you're wearing a mask or not post February 28th, judge or in any way think that is an issue, that someone is wearing a mask. That's where they have landed for whatever their reasons are with where they feel safe in that particular environment. And we as individuals in Saskatchewan should always accept that. Accept the fact that other people are going to be making their decisions. They may be somewhat different than the decisions we're making, but we respect them for that.
Follow-up question?
Yeah, if I can ask a clarification before my follow-up. You mentioned not wearing masks after February 20th. Is that a for sure that masks are lifting on February 28th then?
Yeah, the public health order around masking will be expiring on February the 28th, and we're not looking at renewing it. So it won't be renewed.
And then my follow-up, on January 12th, Premier, you extended the existing measures to the end of February. And on January 26th, Dr. Shahab said we should stay the course with those existing measures for another 4 to 6 weeks to prevent a rebound of COVID. What's changed since then that we feel we should drop those now and not have a rebound?
I think we're right within that 4 to 6 weeks, maybe a week earlier on the proof of vax, but we're right in the middle of that 4 to 6 weeks. January 26th to February 28th is over 4 weeks. And the proof of vax, I guess we've pulled forward about 2 weeks. And it's the decisions that we've made collectively with respect to where we are, where society is, and ultimately the effectiveness of the public health orders that we have in place, and the tools that Saskatchewan people have in place to utilize in conducting their personal risk assessment each and every day. We have widespread access to vaccines. Among the highest booster dose rate in the country, in particular a very high booster dose rate of uptake in our elderly. We have rapid tests available. We have early intervention therapies that were not available even prior to Christmas in any degree, monoclonal antibodies as well as Paxlovid. All of these are available to ensure that we can, one, move back to a much more normal environment in our daily lives, and two, to ensure that should someone get Omicron, we have the tools available to keep them out of hospital and keep the symptoms as unsevere as possible. What I'm saying here today as well as we find our way through the last of the two public health orders that we have in the month of February is if we truly are to go back to a place where we were in our friend group, in our family groups, in our communities, and in our province 24 months ago, just prior to when COVID hit, we all need to make an extra effort to understand and respect everyone's right to make their own decision.
Next, we'll go to Jeremy.
Yes, thank you. Premier, how much influence did the Convoy protests have on this decision today?
How much which does it have? How much
influence did it have on the decision?
I don't think there's multiple convoys that are happening in various areas of the province, and I think many politicians have spoken to separating out some individuals' comments in each of those convoys from the broader effort and initiative of people that are attending those convoys to have their voice heard like any other protest. And I've been clear around instructing and asking all of them to follow the rules or ultimately face the consequences from law enforcement officials. I think when you look at influence in the decision that the government is making today, There is influence from people across the province. I would say not specifically convoys, but we have a large number of MLAs on the Saskatchewan Party on the governing side, and they have been talking to their constituents throughout this pandemic since the time they've been elected, but have been listening and listening very closely, in particular to changes in trends and reasoning behind. People's comments to their MLA, as well as listening to, we've often talked about the consequences of public health orders, the unintended consequences of public health orders, listening to, families at times very impactful stories around some of those consequences. Ultimately, you blend that with the science that we have. When you look at the Omicron wave being very different than the Delta wave, and I said in my opening comments, we were reluctant to bring in a policy like this because it is a divisive policy. It does segregate people in our communities and in our society. When you look at the effectiveness of that policy, it proved to be very effective in finding our way through the Delta wave, increased our vaccination rates markedly here in the province. As you look at the challenges of transmissibility with the Omicron wave and the case counts that we have, whether they be vaccinated or unvaccinated, this policy most certainly has run its course. And so it's time for us to move to the next steps or the next stage of COVID, and that is one that doesn't include a proof of vaccination policy. So, to answer your question on any convoy, individuals, yes, have an influence as they talk to their respective MLAs. Whether or not they're in a convoy, they're still individuals, and we respect that.
Just a follow-up question. You're talking about division and the division we've been seeing. With your previous, support of these protests, do you think at all you participated in any of this division in the province?
Well, I think, aside from some individuals that have done some really despicable acts, and they should be held accountable for those, the bulk of what you're seeing in not all of these protests, but some of them, I would go back a couple of weeks to the one in Regina. These are just Saskatchewan people that see the divisions in their family and their friends groups and in their communities, and they're willing to move forward, living with whatever risk is there with COVID, and we're minimizing that by providing the tools for people to use in their personal risk assessment. But they're willing to move forward without the public health orders to move away from some of the divisions that we ultimately are seeing. And so what Saskatchewan is doing today is providing a plan how we are going to move away from our public health orders over the course of the next about 3 weeks. I suspect you'll see other provinces do something similar in the next while. And I would ask the federal government as well, on behalf of all Canadians, to continually be revisiting any of the orders that they have in place as to their effectiveness and ultimately the other impacts, the other consequences that may be evident from some of those public health orders. I think it's incumbent on all of us as governments to put the public health orders in when they're necessary, and those aren't easy decisions, but we're also incumbent to remove them when they have run their course, and that is what we're seeing here in Saskatchewan.
Go to Connor next.
I believe mandatory self-isolation is attached to the same public health order as masking is. So that public health order is expiring. Is mandatory self-isolation also going to?
Yeah, all of the public health orders will expire on February the 28th. Mandatory self-isolation has not been something that has largely been enforced throughout the COVID pandemic. Started at 14 days, down to 10, and now ultimately at 5. Saskatchewan people. They know what's required of them to find our way back to a normal environment. It involves regular testing, and we have rapid tests available. I did one again early this week, and it involves, when you do test positive, that you isolate yourself for a period of 5 days so that you're not spreading COVID to other people. And it's our expectation that Saskatchewan people are going to continue to do what they've been doing for quite a period of time now. Do you have any other comments on that, Dr. Shaw?
No, I think, the few people who will be going for PCR testing, obviously they'll be in a clinical pathway anyway, and like the Premier said, the vast majority who were either staying home because they were symptomatic and not even accessing rapid antigen testing or accessing rapid antigen. They've been isolating. There's been no notification or enforcement process for that anyways. So, I don't think that order expiring will have any, significant impact. And we have to remember that now COVID will be like, living with COVID means that COVID will be like so many other diseases that we may on occasion get. We stay home if we have a cough or cold or flu. If we have, rarely sometimes, if we have pertussis or measles, there's specific isolation criteria for that, which public health advises. So similar provisions.
Follow-up question, Connor?
Yeah, might be crossing into SHA territory a bit, but I think the other remaining sort of measure or restriction, if you will, is the level of visitation restrictions at long-term care homes and personal care homes. So should residents in those spaces expect to continue that level of precaution being taken? I know a lot of them are feeling obviously want to see their family, that kind of thing. So what's, I guess, the future look like there?
Dr. Shahab, you might have some more specific comments on this. I'm not certain, but I should clarify that what we're doing today is on Sunday, February the 13th at midnight, the proof of vaccination, proof of negative test policy will be removed for all customers as well as employees in any provincially regulated workspace. February 28th, the public health order will not be removed. Thus, on March the 1st, masking will no longer be mandatory in schools, public places, everywhere. We are working, save for within Saskatchewan Health Authority facilities, and the Saskatchewan Health Authority is working right now on operating environments as we move forward in our long-term care centers, for example, and all of our health authority facilities as to how they ensure that those facilities, understanding some of our most vulnerable family members are in them, ensure the safety, but also ensure the access for family members to continue to see their loved ones in the days ahead. So there'll be more to come specific on the Saskatchewan Health Authority in the weeks ahead. What we're talking about today is everything else. So what wouldn't be covered with today's announcements would be federally regulated industries such as transportation, telecommunications, and the Saskatchewan Health Authority is working on their own distinct plan. Everything else would be covered with today's announcement.
And next.
Thoughts from on I guess, what you think should happen there?
So every cough and cold season, special provisions apply for long-term care facilities. Clinical environments, obviously, depending on the nature of the environment, specific provisions apply, which will continue. And then if there's an outbreak or other concern in that area, either in the facility or in that area, then further precautions may be put in place. But that will again apply to, for the most part, long-term care facilities, clinical areas, where there are people at high risk who really can't control the environment, unlike individuals can. But as the Premier said, I think some of that clarity will come over the next few weeks.
Next, we'll go to Mickey.
Yeah, in November, there was a law passed to protect employers from lawsuits when asking for a proof of vax or negative test. I was just wondering if that law will still protect employers who choose to keep their vaccine policy, and can businesses or employers keep their vax policy or mask mandate?
Well, I won't advise them as to whether or not they can keep. I'll speak to the vaccine policy first of all, maybe the masking policy first of all. With respect to masking, if a private business chooses to have a masking policy in place to enter that private business, there's really nothing the government can do. Customers would make their choice as to whether they attend that business or not. With respect to something that is quite different, and that's requiring a proof of a health record for entry, it is the goal of this government that no one, whether it be a teacher or student in school, whether it be an employee or whether it be a potential customer of a business, is required to provide a health record to gain entry to that building. So the regulations that were in place indemnifying businesses to act on the proof of vaccination policy for customers and for employees should be considered temporary, and it will be removed post February the 13th. So if a business should want to consider with a proof of vaccination or proof of negative test policy, my advice to them would be to consult their lawyer because the government is removing any temporary protections that we had in place. And that is to create a unified access to schools, to businesses, and to our communities for all Saskatchewan residents.
Follow up, Mickey?
Yeah, if maybe both of you can weigh in on this question, but we've heard the risks of COVID-19 measures are starting to outweigh the benefits of them. What impacts are they starting to have on society or other areas of public health?
You want to speak to that, Dr. Shaw?
Yeah, so I think, in terms of, this is this question has many levels of answers. Like in the healthcare system, I think, whenever our hospitalization has gone up, for specific periods of time, there have been other service slowdowns that then have had to catch up. So that's on the healthcare side. On the public health side, I think public health teams have been trying to make sure that childhood vaccines remain up to date. But we've seen in other parts of the world that, there's been measles outbreaks, for example. So again, there's a message to all parents. I think what we have seen is that for the most part, childhood vaccines have been keeping up to date. But again, that is critical as well. We've talked a lot about mental health supports that they need to continue. There were challenges accessing them. They were addressed by the SHA and other partners. So that's on the healthcare side. But I think on the other, again, this is not for me to comment on exclusively from a public health perspective, but I think the impact that, especially in the early days of the pandemic, the impact it had on children in terms of not being able to be in class, in terms of in-person learning, the fact that maintaining in-person learning was a priority, and that once school started, mask use was a feature for the last 2 school years. This is the 3rd school year where children have been wearing masks consistently and really well. And obviously, I think it's really important to support children as we transition in March, so that, it's perfectly fine to not wear a mask if a child wants to wear a mask or has a medical condition for which they need to wear masks. Again, it should not be an issue either way. And of course, it is always a challenge to slow down extracurricular activities, sports. We try to do that as little as possible. But again, now that other activities for children are picking up, I think that is going to be essential for normal childhood development. And again, I think this week in class, learning started at the University of Saskatchewan, may start at some point at UFR. But again, all these things are critical things in terms of growth and development for children and young adults, which I think is important that they proceed in a way that may be a bit different than it was in 2019, but as close to living with COVID as we can.
I would just add to that, the decisions that we've made and other governments have made throughout the COVID pandemic have always been with an eye to do everything we can to protect our healthcare system by also keeping things as close to normal as possible. As we move forward, there's plans in place that we've talked about publicly with respect to how we are increasing some of the capacity within our healthcare system. We have an increase in our surgeries that is planned and has been publicly communicated, increase in our ICU beds, our ICU capacity in Saskatchewan. And I think you'll see some of that across Canada as Canada is, in our publicly funded, publicly delivered healthcare system, we have far too low of ICU census when you correlate that to other countries around the world. That is going to take additional staff, and so we're working right now on necessary increases to various training programs. Is there recruitment opportunities for people to come here and work in our healthcare system to ensure that our healthcare system is resilient as we move forward, and working closely with other provinces to have it properly funded from the federal perspective through the Canada Health Transfer. But Dr. Shahab has spoken, to the divisions. We said earlier, there's folks that are at times have been unable to see their family in our healthcare system or in our long-term care homes, and that has been challenging. We're finding our way through that here today. There's been divisions in our communities. The convoys came up. We have convoys literally in every province. To my understanding, across the nation, we have borders that are being blocked at multiple areas, and these are for, in a large part, people that want these divisions ultimately to go away. And every day, we wake up in this nation focused on the latest COVID numbers, the latest COVID hospitalizations, and as we truly try to find our way through our past, it's going to take some effort for each of us in what we do in our daily lives. There's children. Dr. Shahab had referenced, the growth and development of children has been impacted over the course of the last 20 months. At times, they haven't been able to go to school, they haven't been able to participate in anything extracurricular, and we most certainly don't want to experience that again. We want things to be as normal as they possibly can, and that's what today's announcement is about. And it's going to take some effort. I've said this many times today. This is going to take some effort from each of us as individuals, and we've given this effort before on a daily basis. I was reading through some quotes the other day, and there's one that I think really summarizes where the Canadian population is today, and hopefully maybe where their headspace would be as we look ahead. And it's from if there ever was a great politician, Winston Churchill, I think, would be in the running. And it goes like this, and I quote, "If we open a quarrel between past and present, we shall find that we have lost the future." That most certainly is where we are in Saskatchewan. We have a great future to look forward to. We have the opportunity, if we all are doing our daily risk assessments, respecting other people's opinions and decisions. We have the opportunity to truly lead Canada through this latest wave of Omicron COVID variant. We also have the opportunity in this province, we've seen the various investment announcements, to really lead this nation and to lead the world in a fulsome economic recovery, providing quite likely better careers for many of us, and better careers, ultimately career opportunities for that next generation, our children. If we come together, Saskatchewan can really be on full display as to what a community, what a province, and ultimately what a nation can achieve in what is following a very, very challenging 20 or 22 months.
Next, we'll go to Lisa.
I guess why the rush? I mean, it was going to end at the end of February anyway, the proof of vaccination. So what, I guess, positives are you or the people of the province going to be getting in those 2 weeks that wouldn't be outweighed by giving those 2 weeks to hospitals to maybe get some more breathing room?
Yeah, I don't think Dr. Schwab, you might have comment on this. I don't think public health measures, when they're implemented or when they're removed, both are difficult decisions, are ever considered, solely on a calendar time frame. There's many other factors that go into those decisions. Where's the case counts? Where's the hospitalizations? What's the trajectory of those? What tools do you ultimately have available? And we feel at this point in time, with the declining trajectory in our numbers, which are as of Sunday, which was the last day numbers were released, we're down. Our 7-day average was down 42%. Our hospitalizations down 12%. Our ICU admissions down 16% as of last Sunday. So as our trajectory is on the appropriate in the right direction, we ultimately feel that this is the time to come out today, make the announcements around the proof of vaccination policy that'll be ending this Sunday at midnight. That provides government some time to change some regulations. It provides businesses some time to make the necessary changes in their place of business for both their customers as well as their employees. And ultimately, providing the opportunity for masking through till the end of February will allow these numbers to, further decrease over the course of the next number of weeks. There was some discussion raised by the Minister of Education as well around the fact that we do have a week holiday in our schools at the end of February, where there will be no student or for the most part staff in the school facilities as well. And so our students and our staff will go into that holiday with a mandatory masking measure in place, and we'll come out of that week off without one, where it will be lifted. That's not to say that some individuals, students and staff, may still be wearing masks, and that's fine. I think mask wearing is very much normalized in our society, and I'm certain in some instances, many instances, you will see a certain portion of students and staff that will remain wearing masks post that February 28th date. And I think all in all, providing the plan over the course of the next number of weeks just provides us all with a little bit of an opportunity to think about what it truly means in getting back to normal. And part of that is we're all going to, as I said many times today, we're all going to be doing those personal risk assessments. And we also need to remember that other people are doing them as well, and they may come to a different conclusion, and we need to, accept that, and most certainly respect the fact that they have landed where they have landed.
Follow up, Lisa?
Just before I ask my follow-up, I'm wondering if Dr. Shahab has any thoughts?
Yeah, I think, first of all, if the Delta wave had ended like it did in December and Omicron had never come about, we probably would have exited these measures, earlier. Of course, Omicron came when it did, first in, other parts of the world, then in other provinces, and then late December in Saskatchewan. We did need to understand how Omicron is different. And once we understood that, obviously, it became quite apparent, like has been discussed, at length last week in the technical briefing, that, once you're more than 3 months out from your second dose, the benefit to reducing hospitalization persists, but the benefit for getting mild illness or transmitting goes down significantly, and is, very low by 6 months post your second dose. A booster dose does increase a booster dose decreases significantly your risk of hospitalization in every age group, but especially if you're older or have risk factors. So that's why, getting your booster dose at every age, 12 and older, but especially if you have even mild underlying risk factors, or if you're older, I think will remain critical. And we have to remember that booster doses, we were one of the first province to open up booster doses in an age-based, risk-based fashion. There was no requirement to get a booster dose, but it was not covered by the proof of vaccination. But we have had a very significant uptake of booster doses that will, serve individuals who have received the booster dose well, and will reduce pressure on hospitalizations going forward. We hope all the way into fall, by which time there may be other considerations based on what's happening at that time. So with all those perspectives in mind, there's never, there can always be some back and forth in terms of when actually an order can be lifted. But as the Premier said, the government's decision was to lift that, 13th of February. And same, the discussion on the mask use. 4 weeks ago, we were looking at the trajectory of Omicron in the UK, in Ontario, Quebec, very quick surge up. We were gearing up for that. Rapid increase in hospitalizations, which again happened in Saskatchewan. But with the two measures that we had in place, and without any additional measures, I think our trajectory, and this again is a credit to the people of Saskatchewan, the fact that they have been, staying home if they're unwell, seeking self-testing, getting the booster dose. Our trajectory of case numbers, as much as we can determine, wastewater surveillance, hospitalizations, it is actually tracking better than even the most optimistic scenarios. And I think that is quite significant. Obviously, we still need to stay the course till the end of February in terms of the orders that remain. And even after that, I think people at high risk need to, assess the risk, get a sense of what is the transmission in Saskatchewan and Canada, because at this point, we can't predict, will our transmission of Omicron go to virtually undetectable level at some point? Will it plateau at a certain level? Will there be ups and downs provincially or locally? And based on that, I think we'll have to continue to readjust at an individual level, and the implications for long-term care facilities in terms of will they continue to see outbreaks in March, April. All of that we can't predict, but I think those things will continue to be monitored, and the epi summary will speak to all of those things. But I think right now the trajectory is looking quite favorable towards the end of February. But again, staying the course for the next 3 weeks is going to be important. And again, I always say that, the vaccinations remain available. We are very privileged in Canada compared to other parts of the world to have vaccines available for everyone 5 years and older, and booster doses for everyone 12 and older. And I think taking advantage of that will serve us well as individuals, as families, as communities, and reduce the pressure on the health system all the way into the fall. And of course, as long as there's a global pandemic, if there's anything that is different anytime into the future, we will be monitoring that and we'll have to adjust accordingly.
We've kind of seen this before. Last July, we took down all health measures and then cases went up again. So are you anticipating that cases are going to go up once these public health measures are gone? And if they do, what is the threshold for putting health measures back in? And are you going to be, how much is the response to the fourth wave going to be kind of in your head as you're watching that?
I'll maybe make a comment, Dr. Schaub, and you might have some comments as well. Listen, if there's another wave that comes, we'll assess what that wave means and is at that point in time, as far as transmissibility, as far as, is it acting more like Delta with respect to the impact on the healthcare system, or more like Omicron, or potentially even maybe less challenging than Omicron from a hospitalization perspective. So if there is another wave, and I believe maybe we've seen part of one in places like Denmark that was again much different, but we'll manage our way through that like we have every wave thus far. Significant difference between now and any time previous are the tools that we ultimately have available in Saskatchewan, and to the degree that Saskatchewan people are utilizing those tools and understanding the factors that go into their risk assessment each and every day. We have a much higher vaccination rate. We have booster doses that are available. The vaccines are available to a much broader age group than at any time previous. We have rapid tests available in this province, unlike virtually anywhere else in Canada. We have early intervention therapies that will help people ultimately that do get COVID and may be immunocompromised in keeping their symptoms as not as severe as we possibly can. None of those tools were available when we look back over the months and now years that we've been managing our way through COVID. And Dr. Shahab had said something a moment ago that I think really deserves a shout out and credit to what Saskatchewan people are doing each and every day. We didn't attain some of the forecasts that we thought would be attained here in Saskatchewan in the way of not only case numbers but hospitalizations, and we did so when you look across Canada with a very different suite of public health measures in place than what we saw in virtually every other province. The ones that were in place proved to be helpful, but what really I think has allowed us to be at the levels that we're at and be able to ultimately make an announcement like we are today is the fact that Saskatchewan people have been paying attention, and they are conducting themselves very responsibly. They're self-isolating when they test positive. Some are even self-isolating for a day or two if they're a contact. People are doing the right things out there. People are negative testing. I cannot, and I'm thrilled, but I cannot believe the amount of personal at-home rapid tests that are being utilized when they're necessary by individuals and families, and how they're breaking that up in amongst their family, where one is testing at a certain point, and as to preserve the tests that we have. And so, a credit to Saskatchewan people for everything that they're doing, and I think it is any positives that have come through the Omicron wave in not achieving some of the forecasted hospitalization levels is because Saskatchewan people have been responsible each and every day. And the fact that we're out here today charting a course through the last couple of public health measures we have would not be happening if Saskatchewan people had not conducted themselves as a group in such a responsible way over the course of the last number of weeks and months. So thank you to each of them. Dr. Schaub, anything to add on that?
Yeah, I'll just add that, based on our weekly reports on other evidence that people hear about in the communities. How frequently we do, even antigen testing may, stabilize at a certain level or go down over March, April. Obviously, weekly reports will continue and then go down to monthly. But, further to your question, if there's again a sense that, there's an increase in transmission, that information will be made available. So maybe people who had reduced doing their antigen testing because things are settled down may restart doing that, or may change how they wear masks, or that will remain throughout the latter part of the spring and summer. And again, we expect in the fall, we can't predict anything with certainty, but in the fall likely there may be a resurgence of COVID, either the same variant or a subclade of that. The Premier, I think, was referring to BA2, which we've seen small amounts of transmission, but that has taken over to a significant degree in Denmark, but hasn't increased in hospitalizations and has plateaued at a certain level, to a lesser degree in the UK. So all those things, I think, our lab partners will be monitoring, will be publishing a lot of that information in our weekly reports or through special reports as required, that will help all of us decide what we need to do March, April, and onwards.
Thank you. We have time for a few more questions, so we'll get to as many as we can on the phone. Operator?
We have Adam Hunter with CBC.
Thanks for taking my question. For the Premier, I just wanted to clarify, earlier you were talking about, private businesses, school divisions, municipalities. Just want to be clear, what are they going to be allowed to do as far as proof of vaccination and masking going forward past March 1st, or I guess past Monday with proof of vaccination, then past March 1st? Will they be allowed to put in their own policies? Will it depend, or is the government saying that's not going to be allowed? You had mentioned lawyers at one point.
Yeah, what I said, Adam, and thank you for the opportunity to clarify, is the government has put in place some protection for businesses, I believe for municipalities and the provincial government, to enact the proof of vaccination, proof of negative test policy throughout when it has been in place in the pandemic. That regulation will be repealed on effective midnight February the 13th. And so the provincial government will not be moving forward with any proof of vaccination, proof of negative test for any of our provincial employees past that point, or any customers that enter a provincial business or operation of any kind will not be required to provide that proof of vaccination or proof of negative test. If a municipality or a private business wanted to move forward with that policy, I suppose they should do so. My advice would be to consult a lawyer because the protections that the provincial government provided will no longer be there, and they may open themselves up to some vulnerability. And so I won't provide advice or say whether private business is free to do what they choose, but they also may have some consequences that would be a result of that. Our goal as a government is to provide access much like we had 24 months ago previous to COVID being here. Access, for example, for all of our teachers and our students to attend school, and all of the staff that are in our schools without providing that proof of vaccination, proof of negative test, but also to provide access to our community facilities, whether they be municipally owned or whether they be privately owned, and restaurants and businesses, retail, whether that be an employee or whether that be a customer. So the government's goal is would be for in an ideal world, for no one to be enacting the proof of vaccination or proof of negative test policy. But in the case of private business, they're free to make their decisions, and my advice is to consult some legal counsel on what the consequences of that decision might be.
And you have a follow-up, Adam?
Yeah, also for the Premier, last night the organizers of the Convoy in Ottawa expressed what they had put out in their memorandum of understanding earlier, that they seek, to talk to the Governor General, seek a coalition with the other parties in an effort to oust a democratically elected government. And you spoke earlier about individuals that are, causing, problems with some of the convoys and protests. But I want to know what your opinion of this is, given that this latest information from this convoy is coming out publicly, and it's causing a lot of problems in the nation's capital.
They're intently causing challenges in the nation's capital, and I believe it's spreading to other areas as well. I understand the bridge between Windsor and Detroit has been at least slowed as well, or at least it was last evening. I haven't checked here yet this morning, and so the sentiment is spreading, and really this is that sentiment of division and sentiment of the broader population of people want to have want the government to have a conversation with them about what this looks like in the weeks and months ahead, and that is what we're doing here in Saskatchewan today. As far as overthrowing a democratically elected government, I don't know that that's going to happen, but most certainly, in spite of some individuals that need to be held accountable for actions that are unbecoming of Canadians, the majority of people, I think, most certainly are in to some degree supportive of what has started as a protest against a mandatory vaccination policy, no proof of negative test option, but a mandatory vaccination policy expansion to the transport industry, but has expanded really across communities to the whole discussion about where we are with the public health orders that we have in place. And I think people want all levels of government to be very frank with them as to what the benefit is, what the inadvertent consequences are of these policies, and when can we look for, in light of reducing numbers decreasing across Canada, when can we look for an expiration date on these policies and attempting to get life as we know it back to some degree of normalcy. What I've said today, and what I would say to everyone, whether it be folks in the federal government, in all parties, or the folks that are in the actual convoys, is as we find our way through these mandates, and I believe we will in the weeks ahead at all levels, we need to make every effort to heal some of the divisions that have been created in our communities. And that's the message that I would like to send everyone today as we find our way, what will hopefully be the last number of weeks of the Omicron wave, is that we have some work to do. We have some work to do in this province. We have some work to do as individuals in our families and friendship groups, and we have some work to do as Canadians on healing some of these divisions and putting our best foot forward so that we can really capitalize on some of the opportunities that lie before us.
And we'll take our next question on the line.
We have Stephanie Davis with CTV.
Hi there. A question for Dr. Shahab. Just a little bit more on schools. We've seen cases spreading so quickly through schools and classrooms. So I guess my question is just, why should parents feel safe sending their kids to school with no restrictions in place?
Yeah, thank you for that. So first of all, obviously we are having discussions within the country on moving forward, living with COVID. That includes a really important sector, schools, that is important for in-person learning with appropriate provisions. And we've always talked about the layered approach in schools. And actually, over the weekend, I was also talking to colleagues and actually parents of children who go to school in the UK, for example. And so in the UK, for example, they have navigated their way out of Omicron with, masks no longer being required, but being optional, with antigen testing being encouraged but not required. And if there's a local increase in transmission in a part of the UK, and there's more mask use. If the transmission goes down, there's less. And I think that is the most likely way that we will have to navigate in March, where some parents may choose to have their children continue to use masks, others not so much. But I think it is important for us to at least and there's been discussion with education already, and me and my colleagues, medical health officers, will continue to have those discussions with school boards. But I think it is important for school divisions and for parents to start thinking ahead, and for teachers about how March will look and feel like, and be able to choose to wear a mask or not wear a mask. And of course, we already know that a lot of extracurricular activities have already picked up, and that's great. And finally, and I think I said that earlier, many people have seen that, in most communities, the Omicron wave peaked a week or two ago and has passed or is passing. So I think that's another thing that over the next 2 or 3 weeks, as that really has passed, and there's a sense that there's very little illness in schools being reported, either through staff absenteeism or children being absent. I think that will lend confidence to moving ahead without a mandatory mask policy in schools as well.
You have a follow-up question, Stephanie?
Yes, thank you. One for the Premier. I'm just wondering if you can talk a little bit about the consultation process in coming to this decision. We heard from a number of unions around the province yesterday just who were calling for the restrictions to stay in place. So I'm just wondering if your government consulted with groups on making this decision or if it was just something that you guys decided.
Ultimately, it was a government decision at the end of the day. We have consulted not only with a number of groups, organized labor representatives from across the province. Our Minister of Education has been in constant contact with, in particular, SSBA board members, as well as our economic ministers have been in contact with various associations across the business profile here in Saskatchewan, as well as, and I've said this many times before, but we had emphasized it again throughout the new year, our MLAs have been in contact with various organizations and associations within each of their constituencies, whether it be local organizations as well as individuals, many individuals over the course of the last number of months. And so all of that input that we receive as a democratically elected government, that we receive on behalf of our constituents and various organizations that are representative in our communities and our province proper, those conversations have occurred. There won't be 100% agreement with whatever the government had decided at the end of the day, and that's why, but ultimately the government does have to come to a decision, and we did. We came to a decision as a caucus, and we blended all of that with ultimately the public health orders that we have in place, the effectiveness of those public health orders, and ultimately the advice that we continue to receive from all of those in the health sector. And so the decision has been made by government to move forward in this fashion, to lay out this what the next 3 weeks look like in Saskatchewan. We feel we're able to get to this point because of what Saskatchewan people have done as individuals and collectively as a society, and we're positive. We're confident. Pardon me. We're confident that this is a path that is good for Saskatchewan and will be supported ultimately by the majority of the people in the province.
And we have time for one more, operator.
We have Murray Mandrick with Leader Post.
Good morning, Mr. Premier. 24,600 people were added to the job roll in January, which I think you noted. That suggests that whatever you've been doing economically, at least in relation to the policies related to vaccines and passports and masking, has worked or was working. So I guess what I want to know is, from an economic standpoint, what's the justification of changing things now if what you were doing is actually kind of working?
Thank you for noting the fact that we have had an eye to the expanding our economic opportunities throughout this pandemic, and when you blend that with some of the data that Dr. Shahab had provided with respect to how Saskatchewan people have conducted themselves through the last number of months, and how that is manifested in a lower rate of hospitalizations that we were expecting in the province. Kudos to the people of this province, because they have allowed, in doing so, our economy to continue to expand and a number of jobs to become available. When you look ahead, and the investments that are already committed to the province, and some of that work is already underway here in Regina and at other sites, and more to come. I would say more investments to come in the weeks and the months ahead. That Saskatchewan has a great opportunity not only to find our way through the last public health measures we have in this Omicron wave, but to find our way as a leader in this nation and around the world in the global economic recovery that ultimately is likely already underway. Saskatchewan most certainly is going to participate in that. One of the other aspects is not directly economically related. but very much is something that we've heard from people, myself as an MLA, as well as a number of other government MLAs, and I suspect opposition MLAs as well, is they do want things to get back to normal, but they do want things to get back to normal in maybe a bold way, but most certainly a responsible way. And that's why we've laid out the next number of weeks. That's why we're not just removing things here today. We've laid out the next number of weeks of where the public health orders will actually be removed in a phased fashion, and that's why today I've spoken at great length that we have another job to do as Saskatchewan people, and that's really to come together in an unjudgmental way, to accept our friends and family for the decisions that they've made, and most certainly don't lose a friend or a family member due to this virus. We have an opportunity to really be an understanding individual, and thereby together an understanding society, and really, in many ways, I think lead our nation through what is a very divisive time right now.
And last question, Marie.
I think people have come together, though. If you look at the number of people that have actually gone out and get vaccinated, what today's policy does is placate those that don't want to get vaccinated. And I get the frustration and the struggle to get them vaccinated, but isn't that the source of the problem? The fights in the family are over whether the outliers will get vaccinated and put other people at risk, and we have 1,000 deaths. So I guess the question is, what is the definition of bringing Saskatchewan people together when Saskatchewan people together have come together on the notion of getting vaccinated, doing the right thing, and today's policy seems to basically say, well, if you didn't do the right thing, we're no longer going to do anything that we can do, or there's no longer anything we can do to enforce that. How is that, I guess, bringing people together?
Yeah, the basis of your question, actually, Murray, I think speaks to really the challenge that we need to get through in ultimately judging people in the province and in our communities. Whether or not you got vaccinated is not the right thing. There are many people that have went out and gotten vaccinated who disagree with the divisions that come about from a proof of vaccination policy or proof of negative test policy. And so what we are doing here today is saying that we are going to move forward without that policy. We're going to understand that each of us has made our own decisions on whether they're vaccinated or not, on whether they're going to wear a mask or not post February 28th, and that's fine. We accept that decision, and we respect you for making that decision, and that's totally fine. That is your decision to make. It's not for me to make that decision for you, nor is it for me to comment on what your ultimate decision is. This is, and we're providing that plan on the steps that we're going to take in the next number of weeks, and I'm asking Saskatchewan residents to most certainly think about how they are going to, address people if they see them with a mask or engage with their family and friends in the days ahead. I think I would further ask outside of the province of Saskatchewan, and because we still will have mandates here, we still will have our federal mandates here in the areas of transportation, telecommunications, travel, that other levels of government, provincial governments, I'm positive are already looking at this, but our federal government also, I think, needs to have a real conversation about what the next number of weeks and couple of months look like for Canadians in the areas where they have leaned in with their federal mandates, which have not had the negative test option, and where people have actually, in some cases lost their place of their employment due to making whatever decision they did. So I disagree with the premise of the question, Murray. I think as we move forward, this isn't about whether or not you did the right thing. This is about all of us in society moving forward together. As I said, many that are vaccinated don't agree with the policies that are in place, and I've talked to many of those individuals as it is. So as we look ahead in this province, we have everything to attain and to aspire to, and we have all of that opportunity before us. The only thing that would prevent us from achieving all that we can be is for us to be arguing amongst ourselves. Let's come together as friends. Let's not lose a friend due to this virus. Let's come together as family. Let's not lose a family relationship, regardless of what conversations have occurred over the last number of months. As we look ahead, let's come together as a communities within a great province and achieve what we know we can achieve. The opportunity is there for us.
And thank you all for taking the time to join us today. That concludes our availability.